Teeth whitening, that is the most non-invasive procedure that we do here in the office. It's so simple, so easy, and it really produces dramatic results for most patients. Basically, patient comes in for a 60-minute visit. During that time, we scan the teeth now for small trays that you use at home for about a half hour a night. The nice thing about the scanner is we don't use any of those messy impressions anymore. Remember those days maybe when you went to the orthodontist or when you were a kid and you had to have silly putty basically placed in your mouth? It has gotten so much easier with the three-dimensional digital scanner that we could fabricate the trays without the messy impressions. The other thing about the 1 hour visit is we place a 39% hydrogen peroxide gel on your teeth, and we do that for two 20-minute segments of that visit. That should lighten your teeth at least 2 or 3 shades lighter, but what we're trying to achieve is 5 to 6 shades lighter. To achieve this goal, we then give you these trays that we made with the scanner, and you will be provided with 9% hydrogen peroxide gel that you'll place in the trays and wear a half hour a night at home or at work or at the gym, wherever you're comfortable, and have a half hour to do that. The gel that you're provided with should last you anywhere from 7 to 10 days. The nice thing about being able to do this at home or out of the office is that you have control on how white you would like your teeth. That's a constant question I always receive is, well, what if my teeth get too white and I don't want them to look fake? You have total control, and you'll see every day the degrees of lightening. After 5 or 6 days, you might be totally satisfied, then you just stop, and if you have any leftover gel, which you should, you just save that for later on if you need a touch-up. The thing about whitening, it's not permanent. It will change back to your normal tooth color anywhere between a year to 3 years. It all depends on the patient. The touch-up session in 1 to 3 years is very simple. You just come into the office, again, for about 45, 50 minutes. We'll do a touch-up here with the 39% hydrogen peroxide, and we'll give you some more take-home gel to use at your convenience. The thing that's really great also about whitening is we can remove yellow, green, and brown stains, some stains due to medications. And the one thing that everybody has to be careful is during the bleaching, the whitening process, and bleaching is also a term used basically on the street, a layman's term, and that's appropriate, is that you have to be very careful of all the dark staining foods. Things like red wine, coffee, tea, the dark juices like cranberry juice, grape juice, even sort of dark foods like tomato sauce sometimes can cause stain. The good thing is the stain can be removed and it's reversible. But we always recommend during the whitening process that they try to avoid these foods. If you're a big coffee drinker, and a lot of my patients are, I always tell them to make sure they put a little more milk, no espresso. You could always drink the coffee with a straw. That's not an issue also. The beautiful thing is that you come in for one visit, and that's almost always that's what you need, and then you leave with a beautiful smile and a nice glow of confidence.